foundation. So many of the students here yes, and we have Jean-Pierre. She's an osteopath for over 20 years, and she organizes Dr. Barral's osteopathic courses in France. And of course, Matthias, he's an osteopath also, and he's a visceral manipulation instructor in Italy. And the man himself, he needs no introduction, makes my job easier. You have all studied his material and his books, so that's why you're all here. And please welcome Dr. Barral.
It works, yes, you can hear me?
Yes.
Ouais? Maybe. Voilà, bonjour. Merci. Bonjour. So we have a dream team, okay, dream team. AJ, okay, Ghislaine, and Matthias. So they are, we in BI, we like to work together, okay? And we feel good when we are together. No jealousy, no somebody trying to kill me, okay, for the moment. So I like these people very much. Alors, the course. Okay, the course is spine, the spine. Okay. Alors, why there's something new about the spine? Because when we speak about the spine, we speak about, of course, the joint. We speak about the disc. We speak about the arteries, the vein, the fascia, the muscle, the skin. So we try to do emotional also. We try to do something complete. And it's because if you just see a little part of the body, you will miss many things. So we will start by the cervical spine. Cervical spine. D'accord? Alors, cervical spine. What is so different on the cervical spine? First, we have is the only vertebra we know with some artery which runs inside the transverse foramen. Okay, there is no other example in the skull, in the spine. Sure. And of course, when we say artery, we say also vein. I don't put the vein on the artery at the same place because it's too narrow. But the venous system, very often, is more important than the arterial system for the cervical spine. Okay, so that's what we call the vertebral artery. Vertebral artery. Diameter is about 4 millimeters, so it's big for an artery, vertebral artery. Vertebral vein. Vertebral vein. Of course, they are on both sides, huh? Vertebral vein. All the venous system of the skull will go, the posterior part, with cerebellum, for instance, and with pons, the medulla oblongata, will go in direction of the vertebral artery, vertebral vein. Okay? So, when you treat somebody for the skull, if you want to have a big effect on, for instance, the cerebellum, and you know that in whiplash, a lot of people have some problem with the cerebellum, we must work also on this part to try to decompress a little the tension, the hypertension which is created by the vein, okay? Because the skull needs to have a pressure of about 15 centimeters of water. And very often after a whiplash, for instance, you have 30, 40 centimeters of water, which give headache, dizzy spell, lack of balance, and also some hearing problem like tinnitus. If we take the skull, for instance, because to believe that in the skull you have just the joint, the sutures, and so on. Remember that in the skull we have this pressure, we have what we call the turgor effect. Turgor effect is between the skull and the brain. Just to explain that we cannot be specialized in our job. Okay, so that is the brain. Yep. And where's the venous system? Venous system. So the posterior part, okay, coming from the vertebral vein, could permit to have a quite of negative pressure inside, okay, negative pressure, a little less than the jugular vein, which permit to the brain to be less heavy, because if you remember, the brain is about 1 kilo. The weight of the brain, 1 kilo, 3 or 4, okay? And when you move your head, you don't feel the brain, of course, there is, the venous system plays a big role in order to lighten the weight of the brain. If you have, for instance, some cervical arteries, some cervical problem, it's like your brain will be a little heavier, and the situation not so good. If we take the role, one of the roles of the vertebral artery is to create what we call the turgor effect. Turgor effect means that the brain must occupy the maximum of place inside the skull. If your brain doesn't occupy the maximum of space, each time you will move your head, you will irritate your brain or damage your brain. The brain must be like inflated, okay? You understand? You have no problem with my English, no? A little French? Okay. So you are polite. So the turgor effect, so the arterial system gives the turgor effect to the brain. Okay, and in case of whiplash, for instance, you have no more this turgor effect or less, so it's like your brain moves a little bit and you have more problems than you believe. I'm very focused myself on whiplash because it changed your life when you have a whiplash, and it changed totally your life. And the point for us is to evaluate if we have a good circulation on the vertebral artery and venous system. Okay? How to evaluate when somebody comes to see you if there is a good circulation on the brain. Alors, comme ça. Quelques personnes from behind. On both sides. So we have, we have the muscle, trapezius, and scum. SCOM is sternocleido-occipito-mystridian muscle. Okay? So SCOM, trapezius. The two muscles are surrounded by a fascia, maintained by a fascia, like it. Merde, c'est pas ça. I'll take the green. Okay, that is what we call the trapezo-scom fascia. Why is important? I will answer. Just at the top, you have the vertebral artery and vertebral vein. D'accord? Sorry, no, not vertebral. Occipital artery, occipital vein, and occipital artery. Occipital artery. On both sides, of course. Really? So we put on both sides. Yep. Yep. Now. So when somebody comes to see you with a cervical problem or a skull problem, one of the first thing is evaluation of the occipital artery, because this artery has an anastomosis with the vertebral artery. So, if we come back, we have the vertebral artery, okay, and we have an anastomosis with the occipital artery. When you check the pulse of the occipital artery, you check the pulse of the vertebral artery, so you know if your cerebellum is fed correctly by the circulatory system. You cannot evaluate the vein, because the vein there is no pulse. If you have a weak artery, the point very often is on the weak side, and it means also that you have a weak venous circulation. Okay? So it's very important for people with lack of balance, dizziness, okay, some headache also coming, because just above, we have also, we will see the greater occipital nerve. Greater occipital nerve. And this nerve, we will see, is so important because connected with the trigeminal nerve. All people with migraine, with headache, if you cut the trigeminal nerve, you have never headache and migraine. It's a nerve of migraine and headache. And we'll see that we will evaluate also this nerve, because we can help a lot of people with that kind of disease. If it's not clear, you tell me, because I can do it again. If I'm going too fast, not fast enough, complain. No? Alors, first lab we will do now is to evaluate the two arteries pulse to know if you have a good circulation. When you have a kid, a baby, with plagiocephalia, okay? So the skull is a little deformed. When you have a baby with a lot of weight, it's one thing to do, to know if you have a good circulation of this artery. That is very important. Works or not? No?
Yeah.
Works? Ouais?
No, not anymore.
Ah ouais. Something bizarre happened. No?
No.
No?
No.
Doctor? Ah, si, it works. So, I believe.
Am I good or not?
He has all the talents. Alors, so I need somebody to. So I need a volunteer. Who come?
Okay.
No, we have somebody. Excellent. What's your name?
Thomas.
Thomas. Welcome, Thomas.
Bonjour.
Bonjour. Tu parles français?
Un peu.
Voilà. Glasses off. You lie on your. Lie on your stomach. You put your head like it. So you always start by the caudal part, okay? You don't come here, okay? Alors, don't move. So we come here, okay? We come here. We move our fingers. Here we have the inion, okay? External occipital protuberance, or inion. Huh? Everybody knows where is your inion. So you put your fingers flat. And a little above the inion, you have the inferior occipital line. You feel the pulse of the occipital artery. This artery is 2-3 millimeters maximum. Don't compress too much if you want to have the pulse. You move your fingers like it flat. You put your fingers and you compare both sides. Okay? You will see at the beginning sometimes it's a little difficult, but when you have done several times, it's very easy. I repeat, we start from here, we come and we try to feel this pulse. D'accord? Just the first thing we do in order to warm up our fingers. No question? Okay? I repeat, it's very important because this artery gives you the feeling of what happens in the cerebellum. And cerebellum is the first target when you have a whiplash. Okay? We do it. Allez.
Merci.